Good evening, everyone. Welcome to our session today, January 29th of Questions with Dr. Poulos. She has attended the session today with Kane County and is prepared to give us an update on some of the latest things that she heard today. So I am going to turn it over to her so that she can share with you what she learned today. Dr. Poulos.
Hi there. Yes, today, the 25th, on Tuesday morning, I attended a meeting of the Kane County Health Department Advisory Committee. And there are a few updates, as is our usual format. I'll give an introduction, a little introduction, first in English, then in Spanish. And then Martha's going to ask me some questions, several questions, questions that come in through the Facebook Live. And at the end, we'll talk about some newer recommendations. And Natalie is our tech support. So I thought I'd start out with slide number 1 that's shared from our meeting today. And these will be on the website as well for Gail Borton, if you want to see them. So Kane County, actually, we're doing pretty good. In fact, what I'd heard a few weeks ago is that Kane and DuPage, we have the best vaccination rates in the state. And if you look at the numbers, especially for the over 65-year-old population, which is the most vulnerable, as you know, 86% are fully vaccinated and 94% have at least one vaccine. So overall, these aren't, these are reassuring numbers. More would be better, and we can talk about that later. That of the total population, 64% are fully vaccinated. So, and 68% of the population which can be vaccinated, meaning over 5, is actually fully vaccinated. So numbers that could be better, but still doing pretty good. I'm pretty proud of us. I think we've been all doing a good job of either getting vaccinated or, from the public health point of view, trying to make vaccines available. The other number, though, which is the other slide, which is a little more depressing or daunting, is slide number 7. If we could look at that one, is that as I'm sure you know, we're in the middle, or we're maybe right over the crest of the Omicron surge, the Omicron variant of the vaccine, and the numbers have been rather amazing, with a very high test positivity rate. The most recent, and this is a date that is recalculated 7-day chunks. So that's why it changes. If you say, oh, well, I saw something that was different. Well, yeah, it was different a few days ago. Right now, this is the most up-to-date number, a very high number of cases. And so we are definitely in a high transmission area and time. Now, para explicarles en español, if we could go back to slide 1. Hoy yo he entendido a la reunión del condado de Kane, del Departamento de Salud, y en general en nuestro condado tenemos que estar orgullosos porque tenemos buenos números de porcentaje de vacunación. Por ejemplo, de las personas que son avanzados de edad, el número es 94% que han tenido a lo menos una vacuna, y completamente vacunados 86%. De la población que tiene más que 5 años, que si ustedes se acuerdan que los niños menos de 5 años ni se pueden vacunar todavía no tenemos los datos para ofrecerlos la vacuna, aunque en este número completamente vacunados es 68%. If we could now go to slide number 7 again, Natalie, please. Y viendo, pero eso es lo bueno, pero ahorita lo malo. Lo malo es que estamos en una situación de alta transmisión, de mucho contagio. Por supuesto, ustedes saben que tenemos el tipo del virus COVID-19, que es el tipo Omicron, que es muy contagioso, lo más contagioso que hemos visto, y que el porcentaje de las tests que son positivos es 18%, que es bien alto. Era aún más alto más antes en este mes. y también tenemos muchos pacientes en el hospital. Y se considera eso que estamos en una situación de alta transmisión y que tenemos que tomar las varios métodos para protegernos, por ejemplo, usando máscara y todo. Y por supuesto, si no se han vacunado, de vacunarse y de ponerse la refuerza, la booster. Okay. So, with that introduction, I know that the Martha and the library staff had a few questions for me, and I'm sure that some of you are sending questions in, so perhaps we could start with whatever Martha would like to ask me.
Sure enough. When would you recommend that we use an at-home COVID test versus going into a testing site? La pregunta es cuándo se recomienda que se use la prueba de casa en lugar de ir a un sitio para hacerse la prueba.
Well, definitely, before I answer that, I hope that you're all aware that you can all order, every household can order 4 free tests just by going to covittest.gov. It's the easiest form I've ever filled out online. Okay, it's really easy. I understand there were a few glitches for people that lived in apartments, that they were counting a whole apartment building as one home, but they've apparently fixed that glitch. I urge you to do it. You will get 4 tests in the mail. A home test, I think, is useful for a use within a family or within a group of friends. If you have a very mild symptom, a little sniffle, you're not sure, maybe you want to go visit your grandma and you want to test because, you're out and about in the world and you don't want to get your grandmother sick. That's the usefulness for the test. The test is really not useful or advisable or would be accepted for any official situation. I'm certain that it's not acceptable to get on an airplane, for that matter, for any kind of airplane travel, any situation where you need to have actual written proof of what your test is showing. I wouldn't rely on the home test, but the home test is very useful for a couple friends that are vaccinated, but in this era of Omicron and high transmissibility, just want to be sure to do a home test. La respuesta es así. Si necesita un test que es muy seguro y que requiere un comprobante, no se recomienda usar el test en la casa porque, por supuesto, no hay ningún comprobante con eso. Pero es muy útil para la persona que tiene unos síntomas muy leves, que no sé si fuera el COVID o no, o es para una persona que está muy activo trabajando con mucha gente y está pensando visitar, por ejemplo, a su abuela o a una persona delicado o anciano de edad, para estar más seguro que sí se puede hacer la visita sin ponerse a la otra persona en peligro. Ese es otro ejemplo.
Okay, muy bien. How do we know if we are using a safe testing site?
This is a tough one. There are a few testing sites, as you know, in the state of Illinois that have actually been shut down because of shady business, not getting results. People are desperate. There's not, people are at times, I think, taken advantage of. It's really very hard to know. I can tell you where I would definitely trust is obviously any hospital, any of the pharmacies, an urgent care center. I feel very comfortable with those. A pop-up site that used to be like a beauty salon and suddenly there's COVID testing there and you're like, I'm not saying they're bad. I'm just saying that there's a little less certainty. We're in a little bit of the Wild West with some of these sites, But I understand completely why people go there because there's not as much availability as there should, and people are just desperate to find these things out. La respuesta es que es difícil saber, por cierto, si el lugar al que se va por el test es seguro o no. Por supuesto, yo tengo confianza en los hospitales, en los laboratorios que están partes de un hospital, una clínica, una farmacia. No es tan seguro. Hay algunos lugares que están al lado de un salón de belleza o a un lugar que era vacío, de repente dicen free COVID test. No estoy tan seguro, pero yo entiendo que a veces las personas son desesperadas y lo tienen que usar. También hay que tener cuidado si les están pidiendo, por ejemplo, su número de seguro social o otros datos que son muy personales y que no deben de necesitarlas, ¿ok? En esa situación que no se usen. ¿Okay?
Muy bien, doctora. Ok, sí, ¿qué tan pronto después de que me puse mi última dosis de vacuna me puedo poner la del refuerzo, la vacuna del refuerzo?
Okay. Okay, so the question, I'm going to try to stick to the pattern of English and then
Yeah,
Spanish.
in Spanish.
Is how soon after an infection can I get the vaccine booster? This is a very important question that there's some fine points that you really need to ask your doctor, but I'll give you some general advice.
Se nos congeló. Se nos congeló la doctora y yo creo que ahorita regresa enseguida. So doctor is freezing right now. I'm sure she will be rejoining us very quickly to address the question of how soon after a COVID infection can I get the vaccine or booster? This is one that we see very frequently when people come into the library to ask us about how soon they can take the vaccine. And so hopefully she will be rejoining us to answer that. And if not, we are going to add her on and see if she can continue. Hello, doctor. Maybe we can continue here.
Sure. That's fine with me. Now, we were saying, yeah, I have no internet at the moment, so let's just talk for a little bit while I try to figure that out. So the timing, you really need to ask your doctor because there are certain treatments which are used for COVID, in particular, like the recombinant, the antibody treatments. They end in MA, the Regeneron, the Sotrovimab, the Bambolimab. Those treatments would block the effectiveness of the vaccine for up to 3 months. That is the recommendation. So I would definitely not, not give the vaccine in that situation. Otherwise, it's pretty much at the time that you would be emerging from isolation and feeling, well enough to be out and about without a fever, etc. That's the time frame. So it's about 2 to 4 weeks that you can go ahead and either get the vaccine or get the booster. And I will say that I have some patients that after they have the illness kind of have seen the light and realize that, hey, this COVID's for real. I don't want to get this again. And they're very eager to get the vaccine. So that's the situation. Contestando en español, ¿cuánto tiempo tiene que esperar una persona que padeció de COVID antes de vacunarse o de ponerse la refuerza? Esto es muy importante tener una conversación más detallada con su propio médico porque hay muchos detalles, pero en general les puedo decir que hay algunas medicinas que son más fuertes o básicamente son anticuerpos que hay que esperar 3 meses. Pero por las personas que tienen un caso más leve o que no necesitan estos medicamentos, se pueden vacunar dentro de 2 hasta 4 semanas, depende de cuánto tiempo se recuperaron del fiebre y todo. Lo más pronto, en mi opinión, sería 2 semanas.
Okay, good. This is one question we frequently get at the table, and that is that if I received the J&J vaccine, what would you recommend for a booster?
I would recommend either of the RNA vaccines, either the Moderna or the Pfizer, and that it would be as early, really, it is 2 months, because unfortunately the J&J vaccine, it had the conveniences early on of the one and done, and also was so much easier in terms of the ability to, storage
and so forth, and the refrigeration requirements. But nonetheless, that has turned out to be one of the drawbacks. So yeah, 2 months is when people should be getting that booster.
Okay, so in the case of the J&J vaccine, then it's 2 months after to get the booster.
Si la persona recibió la vacuna de J&J, no dura tanto tiempo como las otras y se recomienda que la respuesta sería una de las otras vacunas de la Pfizer, de la Moderna, en 2 meses.
Ok, so, le contestó la doctora, ¿verdad? Que porque se está batallando para oírse, que si usted recibió la vacuna de J&J, que ya pasando de 2 meses, debe de hacer su cita para vacunarse con la vacuna del refuerzo. Okay, entonces here goes the next question, doctor. It seems that with reports that illness for those that are vaccinated is less severe, people are letting their guard down. Can you comment?
Well, I think that in general, people are just tired, emotionally tired of the pandemic and vaccine, and I recognize that that is human nature. However, the problem is that it may be human nature, but the virus has no feelings. It's not tired of us. It wants to use our bodies to replicate. So it kind of doesn't matter how our emotions are. And also, it's less severe. I think it's rather a little bit self-centered to say, well, I probably won't get that sick because there are still significant numbers of people that are ending up in the hospital and in the ICU, even with this Omicron variant, especially the more vulnerable. So, en general, les puedo decir que me pregunto, Marta, si personas ya se han puesto menos preocupados por el virus y no quieren prestar atención en los métodos de protegerse, en las vacunas, en las máscaras, porque se están ya enfadados de todo esto. Y eso es como ser humano, lo entiendo, pero el virus no tiene emociones ni pensamientos, nada más quiere usarnos para sobrevivir. Y el virus no está cansado. ¿Okay? Entonces, nosotros no podemos ponernos cansados también. Y el hecho de que el Omicron parece un poco menos agresivo, un poco menos fuerte en sus síntomas, no significa que no se pueden enfermar y morir personas con el Omicron, especialmente las personas más delicadas. Y entonces, si no para sí mismo, si para las otras personas en su vida que son más delicados o avanzados de edad, se debería de protegerse.
Okay. It appears that they're having trouble hearing us, doctor, and would like you to call in with the telephone number for the Zoom. That would it's on the Zoom invitation. Okay.
It's a 312 number. Yeah, I'll call in right now.
Okay, thank you, doctor. Okay, we apologize for the technical difficulties, and we'll be better prepared next time to deal when your home internet is not what you would like it to be. In the meantime, while the doctor calls in, I did just want to say that we have been, certainly fielding many questions like the one that was just asked right now from people who are reluctant to get vaccinated and as to why they should be vaccinated. I think they have let their guard down, feeling that people are not going to get as sick, and also feeling that perhaps that they're not going to die from it, and also that the vaccine, or people who are vaccinated are still getting ill. So the numbers here are small for people who are vaccinated. We've got millions and millions and millions of people around the world that are vaccinated, and there's a small percentage of those that are becoming ill. So the numbers are just not there.
Hello.
Yes, doctor. Thank you,
great.
Paulina.
Oh, sorry about all the technical difficulties. I feel like I live at the end of the longest cul-de-sac in the world and nothing works right over here. Where was I? I did give an answer about the people letting their guard down. If you want me to repeat that, that's fine. Otherwise, we can go on to the next question.
Let's repeat, because I think they were having trouble with the last few questions.
Okay, I apologize, folks. Just to summarize quickly, the J&J vaccine, get the booster in 2 months. Para la vacuna de J&J hay que ponerse la refuerza en 2 meses, porque es más débil esta vacuna. And the other question was, are people letting their guard down? And the other question that people couldn't hear well is that, and my answer is, I think people are. I think it's human nature to be frustrated and exhausted and disgusted. But please, try to remember the vaccine, the virus is an inanimate, basically an organism that's trying to use our bodies to survive. And it doesn't care if we're tired or not, or disgusted or not. And so, while I understand the emotion, letting your guard down, it's not helping. And yeah, maybe the symptoms are less severe for a younger person, a stronger person, but people are still getting sick with this. And there are still people ending up in the hospital with this that are old and frail, and some young people as well. So, la pregunta es que si yo he notado que las personas en general se han puesto un poco menos, se fijan menos en los métodos de protegerse y no están tomando la pandemia en serio. Yo creo que como ser humano las personas están cansados, están enfadados, pero mi respuesta a eso es que el virus no se cansa. El virus quiere usarnos para sobrevivir, para reproducir, y no le hace el virus si estamos cansados o no. Entonces, y también, pues que los síntomas, el hecho de que los síntomas parecen un poco más leve con Omicron, eso no es cierto para todos, especialmente para las personas de avanzado de edad o con otras enfermedades. Y por eso yo recomiendo y ojalá que las personas se empiecen otra vez a tomarlo más en serio. Okay, sorry.
Muy bien.
All right.
Muy bien. Okay, the next question would be, we seem to have safely used cloth masks up until Omicron, and now we're told that cloth masks are no longer recommended. Is it the nature of the Omicron, or was it never safe to use a cloth mask?
Historically, going back 2 years, when this all started, we were told to use cloth masks in part because there was a real lack of PPE, personal protective equipment, for those people like in the health profession that really, really need it because we're in contact all the time. So that was part of the reason for the original recommendation. The other, so as we're getting more PPE, I think that that's a reason to that there's more, encouragement of people to use a surgical mask. The second thing is that Omicron is different. It's incredibly more contagious, very surprisingly more contagious. And that's why you have the newer recommendation, which I think, in fact, if you want to talk about there's a slide that pertains to this. If Natalie could share the slide, it's slide number 8. Okay. So I know by a well-fitted mask, I would mean, for example, what people sometimes call a surgical mask. Now, the N95s and the KN95s can also be worn, but I think that for the public, I'd reserve those either for people that know they're very much more sensitive or much more delicate, or for people that are going, say, on a plane trip or some situation like that. So, by the way, I'm going to try to join in again. I don't know if I'm joining in again with my video or not. Contestando en español, hay más que un poco de confusión con con las máscaras, y es porque la situación ha cambiado. I don't know if you can see me again or not, by the way.
We can see you again.
Okay, let me see. Maybe
Now
I can.
frozen, so.
Forget it.
You
Well,
on the
at least
phone.
I can see you. I can see you. I
Okay.
can see the side. So, la situación con la máscara, si estás confundido, yo estoy, disculpe, pero usted tiene razón. En el principio de esta pandemia, porque era escasa de máscaras cirujales y las N95, pedimos que el público usaría las máscaras de algodón. Pero ya hay suficientes máscaras para todos. Y también que empezando en fines de este mes, el gobierno va a ofrecer, de lo que yo entiendo, como 3, 4 máscaras por cada persona que se dan gratis y se pueden pedir por las farmacias y las clínicas. Por eso más detalladas los pueden ver en la televisión y en los periódicos. En general, yo recomiendo que se usan las máscaras que se llaman en inglés surgical mask. Usualmente son de color azul y son de papel, pero las más duras y fuertes, como la N95, especialmente en una situación, por ejemplo, si están en avión o si usted sabe que sí mismo que tienes alguna enfermedad como diabetes, cáncer, algo así, que le hace más sensible.
Okay. And here's another question that I see coming in as well. I understand that February is the new June for weddings, and so we have a lot of them coming up, and people want to know whether they can safely participate in large gatherings like weddings, conferences, concerts, gatherings over the next couple of months while the weather is still cold.
Well, like anything else, it's complicated and there's some personal judgment involved. I think for an event that does not involve eating or drinking, where you could keep your mask on, it is, I think that it's acceptable to go to an event, a conference, a concert, or whatever, that you can basically, you're sitting, you're listening to music, you're listening to a speech or a panel while wearing a mask. I feel quite comfortable with that. A gathering that involves food and drink, where obviously you have to not wear a mask, I would be much more cautious. I would question, is there a request that the people are vaccinated? Has the host or hostess asked people to be vaccinated, to get tested beforehand? A lot of these things are a matter of your own personal judgment and how much risk you'll tolerate and how good or bad you feel your own health is. Are you fully vaccinated? Are you boosted? Everything has a trade-off. You really want to go to some event, you're vaccinated and boosted, you know that the other people attending are also vaccinated and boosted. I would personally say probably would feel comfortable going to it, but I can't guarantee. No one can guarantee. Contestando en español, la pregunta fue en el mes que entra, ¿qué sería mi recomendación para atendiendo a conciertos, a bodas, a fiestas? Primero, eso depende en si la situación incluye comida o bebida, porque si nada más es oír a música o atender a una lectura, se puede hacer todo eso con máscara. Y yo, en mi opinión, eso, especialmente para una persona que tiene la vacuna y tiene la fuerza, yo creo que eso sí se podría hacer, es mi opinión. Pero si es una fiesta que incluye comida, que claro, se debe de bajar la máscara, esto no hay que pensarlo muy bien, tomarlo en serio. ¿Cuántas personas son? Si las personas que están atendiendo tienen la vacuna o no, si la persona, si sí mismo tiene la vacuna y la refuerza. Cada persona tiene que tomar la decisión, depende en qué tanto riesgo quiere tomar, qué tanto quiere arriesgar, qué tan importante es la ocasión. No sé si eso les ayuda o no, porque no hay una respuesta fácil.
Okay, muy bien. Due to the technical difficulty earlier, we got a comment or question in comments that refers to maybe some information you already shared, but maybe could do so again. So if you have a family member who is reluctant to get vaccinated, what's the most important thing you could tell them?
I don't think we did go over this yet. It depends. I always ask my patients, if they're not vaccinated, clearly this far into the pandemic, there must be a reason. And one reason people say the vaccine was developed too fast, I don't trust it. The answer that I want to say is the basics, the building blocks of this research were started 10 years ago with the SARS epidemic. COVID is a coronavirus. There are other coronaviruses. They've been studied. Vaccines for them have been studied. And the reason it got developed fast when the pandemic started is that every virology lab, every pharmaceutical company dropped everything else to work on this. I draw the analogy and I looked up the dates. JFK said we're going to put a man on the moon in 1962, and we put a man on the moon in 1969. This was an accomplishment. Getting the vaccine this fast was like the moonshot. So it's something that was in process. It wasn't pulled out of a hat. And we're a year into mass vaccinations. Millions of people throughout the world have been vaccinated. I think that if you had been hesitant a year ago, maybe I could see that point, but now I don't see the point at all. So that's one reason. The second reason is people are saying people are still getting sick when they're vaccinated. So what's the point? I would like to ask Natalie if she could put up, there's a very interesting slide from the County Health Department meeting today that shows you what's the point. It's slide number 4. If we could share that. And we could just leave that up for the Spanish part of the answer. Basically, the difference is you get a little cold, or look at that top line, the blue one that's going zigzaggy up, 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 okay? You want to be in that top line, or do you want to be in the bottom line? You want to be home with the sniffles, or do you want to be in the hospital not breathing, okay? Or you're on oxygen, or in the ICU. That's the difference. That's why bother. So, contestando en español, hay dos tipos de razones que personas me dicen hoy día para no vacunarse, si todavía piensan que no es importante o tienen dudas. Uno es que la investigación era muy rápida y que es experimental. Y lo que no entienden es que ese tipo de investigación lo están dando por más que 10 años, la investigación en el tipo de vacuna mRNA. Y un ejemplo es, por ejemplo, si la ciencia se fija en una meta, puede hacer cosas que son casi milagros. Por ejemplo, de 62, cuando el presidente Kennedy dijo que vamos a poner un hombre en la luna, hasta en 7 años después lo hicieron. Es algo similar, el milagro de esta vacuna, que por 10 años estaban trabajando en este tipo de vacuna por el coronavirus, pero cuando empezó la pandemia, con tanto riesgo por todo el mundo, casi todos los laboratorios y todas las compañías de farmacéuticas se fijaron en esta meta. Por eso fue rápido. Y después de un año, millones de personas en todo el mundo se han vacunado. Ya tenemos bastante experiencia con las vacunas. Son saludables. La segunda respuesta es que no le hace, si las personas me va a pegar sea lo que sea. No vale la pena. Sí vale la pena si se puede mirar en el foto que tienen en el computer. La línea azul es una línea que se va muy, muy más alta. Ese es el riesgo de los números de personas hospitalizados con COVID-19. Y se ve la línea verde, el bajo, que casi no se está levantado. Esas son las personas con vacunas. Entonces, yo creo que se puede ver la diferencia entre estar en el hospital con oxígeno, en el cuidado intensivo, en máquinas, y estar en la casa con un resfriado. ¿Okay? En mi opinión, vale la pena.
Okay. We actually had another question come in, which is similar to one that we were going to cover. The question is, my daughter is not vaccinated. At my request, we wear masks indoors. She asks me if that is for her benefit or for mine. I am not sure of the answer.
Well, it's complicated. I think it's really for both people's benefits. A person who is vaccinated could still get the illness and at least have an annoying cold or some symptoms. So it's for your own benefit to wear the mask, even if you're vaccinated, if you're in close contact and close proximity with someone who's not. And it's definitely for her daughters because she's not vaccinated. So both people benefit in that situation, possibly more the unvaccinated person. I think both people do. La pregunta fue, si hay dos personas en una familia o en una situación que una persona está vacunada, la otra no, y se usan máscaras, ¿es para proteger al cual de los dos? Y mi respuesta es los dos. La persona, aunque la persona que está vacunada sí se puede pegar el virus y provocar algunos síntomas molestosas, a lo menos molestosas, y para personas sin vacuna, para protegerse a eso, porque a veces la vacuna se protege de enfermarse mal, pero todavía puede tener virus en la nariz que se pega a otra gente. Las vacunas no pueden prevenir toda clase de infección, previenen enfermedades que se enferman muy grave con el virus.
Okay. Here's another question. Many states and municipalities are considering lifting the mask mandates. What would you recommend to those who are concerned about being around the unmasked, especially indoors?
Common sense thing. You know your own level of risk in your health. If you're vaccinated and boosted, but you're going to be in a situation with close proximity to people, for example, if you have to attend an event that you know, if you're obliged to go to some type of event or situation that you know will be crowded, wear an N95. You know, if it's just for routine stuff like going to the store, going to the grocery store, if you, even if, which I hope they don't, but if they lift the mask mandate, I'm still going to wear a mask to go to the store. And I would recommend it to my patients.
Okay.
So, es posible, la pregunta es posible que algunos lugares que por las razones políticas van a decir que no es obligatorio usar la máscara en tiendas y en otros lugares públicos. Mi recomendación por mis pacientes sería de seguir usando una máscara. No se pueden forzar de quitársela de la cara, especialmente si está yendo a un lugar en que va a estar en mucho contacto con gente, que va a ser mucha gente, si se considera a sí mismo un poco más delicado, que usa la máscara más fuerte, que es el N95, pero en una situación más rutina o regular, por ejemplo, irse a la tienda, se puede usar una máscara del tipo surgical mask. Okay.
Okay. Are there any new guidelines around COVID-19? I know there's a lot of confusion on what the guidelines are.
Well, there are two new guidelines that I wanted to share with you. If you hold on a second, let me make sure which forms they were. And it caused a lot of confusion. And I get it. There was first slide number 2. If we could share slide number 2, Natalie. Okay, got it. Now, the reason this caused confusion, people are saying, well, why did it used to be 2 weeks and now it's 5 days? And it's not really 5 days. If you look at it carefully, it's 10 days because one of the reasons is because most of the virus transmission from one person to the other occurs either a few days before you're actually feeling sick to 2 to 3 days afterwards. But that doesn't mean that it's impossible. I think these guidelines are an attempt to find a balance between practicality in terms of people being able to go back to work versus really stringent safety. You have to isolate for 5 days. At the end of those 5 days, if you look at it, even if you're no symptoms or very mild symptoms, you can go, quote, out in the world, but wearing a good mask, at least until day 10. And this is for people that have either minimal symptoms or no symptoms, which with someone who's vaccinated and has Omicron, sometimes they do just have the sniffles or nothing at all. They just find out, that they have the virus and they feel fine. But if you're sick, if you're feverish, or if you're coughing, if you're short of breath, it's got to be at least for 10 days. So a lot of these rules, like this 5-day rule, are really for people that really feel either fine or minimally sick. And I would urge anyone that feels that they're being forced, for example, by their employer to come back to work too soon, and they're being told, well, it's been 5 days, come back. If they don't feel like they're ready, to talk to their physician. Okay, so the isolation guidelines, I'm just going to do this in Spanish too. Hay unas nuevas recomendaciones que provocaron mucha confusión, incluso con los doctores, pero déjenme tratar de explicarles por qué cambió la recomendación. El Omicron es más leve y también han visto que la mayoría de la transmisión del virus de una persona a otra ocurre 2 días antes hasta 3 días después del día que empezó a sentirse mal el paciente. Por eso escogieron 5 días, pero hay que fijarse, 5 días si hay leves síntomas o no síntomas. Y después de esos 5 días, si están saliendo de la casa para irse a la tienda, para irse al trabajo, que usa máscara, que una máscara fuerte, no una máscara de algodón, una máscara, por ejemplo, de N95. Y también les quiero avisar que si está usted en situación que no se siente capaz de regresar, aunque que pasaron 5 días y que se siente que su jefe o su mayordomo le está presionando de regresar al trabajo demasiado pronto, hay que pedir un comprobante de su doctor que le da un comprobante de faltar de trabajo por más tiempo. Okay. The second recommendation, if you flip to slide number 3, is the new quarantine guidance. Now, isolation is what you do when you know you have the virus. Quarantine, what you do is if you've been exposed to somebody with the virus. And this is where there's the real advantage to being vaccinated, because if you're not vaccinated, you have to stay home for 5 days. By rights, that's the correct thing to do, to monitor for symptoms. And really don't test until like day 4 or 5. If you test too soon, if you test the day after you were exposed, it'll be negative. And unfortunately, with Omicron, the quick tests oftentimes are false negative, so you got to do a PCR if you really want to know. If you're up to date, you don't need to quarantine. That's a huge advantage in terms of your day-to-day life, but you should wear a decent mask and monitor for symptoms. Okay? So, la recomendación para cuarentena también cambió. Si no tiene la vacuna, está en contacto con un paciente que, por cierto, tiene el virus. Hay que estar en cuarentena por 5 días. Y después de ponerse una máscara y salir, si quiere salir, si tiene que salir, de seguir con una máscara fuerte y por unos 5 días más. Si quiere hacerse el test, ten paciencia. No se puede hacer el test el mismo día o el día siguiente. Hay que esperar 4 o 5 días. Y aquí es la ventaja de estar vacunados. La persona que tiene la vacunación especialmente si tienen la respuesta, no tienen que ponerse en carantina. Nada más de usar una máscara buena hasta 10 días después.
Okay.
So those are two newer recommendations that have caused some confusion. And the other thing I should say is that things change in COVID. These recommendations could change in a month. Well, the virus changes, we have to change. We have to adjust.
Okay, very good. We've had another question come in. Any recommendations for long haul COVID symptoms?
They are so individualized that I really think people need to talk to their own physician and go over it in detail. In general, do not be at all surprised. The two symptoms that I definitely see people struggling with for a long time are cough and fatigue. But there's so much individual variation and every case is different. You need to talk to your physician. Sobre la síntoma de long haul COVID o COVID larga, hay muchas diferencias y no quiero dar una recomendación general. Cada persona tiene que discutirlo con su propio médico, pero en general les puedo decir que hay que tener paciencia, que este no es como un resfrío, no es la gripe. Personas se quedan con tos o fatigados a veces por meses, pero si está en esa situación hay que tener recomendaciones más personalizadas para usted de su propio médico.
Muy bien, very well. Okay, where can we get COVID statistics for our county?
Well, canehealth.org, and I think that the Cane, let me look at here. I think the last page here has, let's see, for information on vaccination is canevax.org. But basically, if you Google the Kane County Health Department, which is, pretty easy to do, you can get the most up-to-the-minute Kane County rates. Illinois Department of Public Health also has rates, but I think we'd probably be more interested in more local numbers and rates.
Okay.
Also, every morning I get up and they tell the numbers on Channel 7 also as well.
Mm-hmm.
No. Para personas que tienen más información, necesitan más información, un recurso es el número que tuvieron en el screen del condado de Kane para los datos más recientes.
Okay, muy bien. Okay, well, I'd like to talk about also, Doctor, that we will be hosting with the Illinois Emergency Administration Agency. Oh gosh, Management Agency. I always screw this up. IEMA, from the state of Illinois. We will be hosting at the library a booster clinic this coming Saturday from 9 a.m. to 4 p.m. It's a booster clinic, but others are welcome to come in on a walk-in basis for either a booster or a first or second dose. It will be for people 12 and over. So we won't have, the only thing we won't have is a children's vaccine. And for more information on that, you're welcome to go in and register, self-register, or stop by the table and we can help register you. For more information, you can visit our website at Gail Borden /COVID Health. And we have lots of information, not just on the clinic, but on other things as well. Our contact information is on there. Our telephone number is 224-765-7370. And we have it here on the screen. We also have an email address, Elgin area Pat, that stands for Pandemic Assistance Team at gmail.com. You're certainly welcome to reach us in any one of those manners. So again, we invite you to stop by on Saturday. If you don't already have your booster, it's a great time to get it done. And again, either by by appointment or by walk-in, we will be taking you in. So please feel free to stop by. Again, that's 9 a.m. to 4 p.m. And Doctor, I wanted to thank you for your resilience and bouncing back from technology changes.
And I also, and I want to put it in a plug as well. Remember, COVIDtest.gov is, you can do it today. Sign up for your COVID test. They'll mail them to your home. And coming soon, there's going to be, I don't know how many masks. I think I heard 3 or 4 masks per person at the local pharmacies. That I'm sure we'll hear more details about.
Right.
So.
I think they said they're at your pharmacies and at clinics, and that'll be starting on, I heard on Friday at Walgreens and soon after at CVS and many other locations. So maybe about 4 masks, that you will be able to claim, and they'll be the N95. So those will be good masks for us to use right now, and hopefully we can quell the rate of infections. Vamos a tener una clínica ahora el sábado en la biblioteca para la vacuna del refuerzo. Va a ser de las 9 de la mañana a las 4 de la tarde. Puede hacer su cita visitando nuestro sitio web en Gail Borden COVID Help, o si no también puede pasar allí por la mesa y le hacemos su cita, y también puede venir sin cita el sábado y se recibe. Aunque es vacunación del refuerzo, también van a administrar las otras vacunas, pero es para personas de 12 años para arriba. So, los invitamos a que pasen a la biblioteca si es que aún no se han puesto su vacuna. Allí los esperamos, y la doctora también les recuerda que pueden ordenar sus mascarillas que ya van a empezar a dar en las bibliotecas, en las farmacias y en las clínicas, y también que puede ordenar su test a ver, doctora, ¿cuál es el link?
Oh, it's COVIDtest.gov.
Okay, COVIDtest.
COVIDtest.gov. La forma más sencilla que he visto.
Así, ya ve. Así es que es facilísimo hacer su orden para sus tests, para que los tenga a la mano, para que cuando usted no esté seguro si está o no está infectado, pues empieza con la prueba de casa, y ya de allí se va más adelante. Well, doctor, thank you. Doctora, gracias que nos acompañó esta vez. Volvemos a reunirnos en marzo y vamos a publicar la fecha.
March 22nd. And thanks. Sorry about the technical difficulties.
Ok, el 22 de marzo, y de antemano les pedimos disculpas por las dificultades técnicas, pero we're here. Thank you, doctor, again, on a very cold night that we didn't have to go out in. So everyone have a really great evening. Bye-bye.
Thank you. Bye-bye.